All right. Good afternoon. My name is Ching Lee. So I'm from Rush University Medical Center, one of the hospital in the medical district. Okay. So I'm an associate professor in the Department of Health System Management. So today it's my pleasure to share about my work about promoting lung cancer screening, especially among older Chinese American smokers. Okay. So as you know, the lung cancer currently is the leading cause of cancer death in the United States. Okay, before we talking more about the lung cancer among the Chinese American communities, let's talk about the key facts about the Chinese American in the United States. So basically, right now, the Chinese American is the fast growing population in the United States. Okay, as you can see, about like 5.5 million of people living in the United States, and about 24% of the Asian American population right now are Chinese. Okay, and as you may know, about like 55.2% of Chinese American, they are foreign born. They are either immigrants from mainland China, from Hong Kong, or from Taiwan. Okay, and here you can see the education status. We can pay attention to the older people, 65 years and older. As you can see, their education level is pretty low, about like 58% of the Chinese American 65 years and old, they with a high school or below degree. Okay, so which means this can bring some health equity issue among this older population because they may experience several barriers to access to care, right? For example, they may experience like language barriers because most of them are immigrants from China and they don't quite speak English, right? So they are not able to communicate efficiently with the physician or with the healthcare providers. Okay. Okay. So as you may know, smoking is the major risk factor of lung cancer in the United States and around the world, right? As you can see about the smoking status, Chinese American, they have super high, not super high, it's higher smoking rate compared to the general US population. As you can see, 80% versus 13.7%. And in Chicago, based on our previous study, we have a longitudinal study. We surveyed the older Chinese American people, and we found about like 25% of the Chinese men, they are current smokers. Okay, it's pretty high, right? Pretty high. But the smoking rate in the Chinese American women is really slow, really low. Okay. And also you can see the smoking rate in Chicago is very similar to the smoking rate in New York City among Chinese American male. Okay. Okay. So this is the some picture from the Chinatown. As you can see, the left-hand side is the restaurant worker smoking outside of the restaurant. Okay, and on the right-hand side, have you been to Chicago, the Chinatown in Chicago before? Yeah, if you've been there, you can see many people, many older men, they're smoking together on the street because smoking is kind of social activity, you know, social activity to hang out with people in China. So when they immigrate to the United States, they keep the behavior. Okay, so this shows you how smoking is right now is a very important public health issue in Chicago. Okay. So this is just a statistics to show you right now about 1 in 14 individual right now is developing a lung cancer. Okay, and about like the 5 years of survival rate of lung cancer is about 26%. But if the lung cancer can be identified in very early stage, the 5 years of survival rate can be increased to about like to 64 or 68%. Okay, so this means the early detection of lung cancer is very important to be able to reduce the mortality of lung cancer. Okay, okay. So the same as I mentioned, as you may know, the smoking is a very important issue, especially among males. Okay, so this means the Chinese American older trans-American smokers, they are at high risk of developing lung cancer maybe in the next 5 or 10 years because many of them are very heavy smokers. Okay, so this is what we think might be very important for us to think about how we can really promote lung cancer screening, especially among the high risk older trans-American smokers. Okay, so this right now, in the past 10 years, low-dose CT has been identified as the most effective way for you to identify early-stage lung cancer. Has any one of you heard about the low-dose CT lung cancer screening? Yeah. So this is the picture. So the entire process of the screening is just maybe 5 minutes. So you lay down on the table, and we'll move into the tunnel and come all the way out, and you are done. You don't need to do any fasting. You don't need to prepare anything. Okay. So it's very easy for the provider to check your lung in a very short amount of time. Okay. Okay. So low-dose CT lung cancer screening has been identified, like I mentioned, as the most effective way to reduce the mortality of lung cancer because based on the finding from a very large-scale randomized control trial in the United States, we call the National Lung Screening Trial. Okay, so they randomly assign people to 2 groups. One is the low-dose CT groups. The other one is the traditional X-ray groups. And they found after the study, like about 15 to 20% of the mortality can be reduced, okay, among the people in the low-dose CT groups. So this is why right now, currently the CMS, they use the result and to develop their guideline for lung cancer screening and it can be covered by Medicare. Okay. Okay, so about the criterion, so here are the 2 criterions. So the first, the screening guideline is from the USPSTF, okay? And the other guideline is from the CMS. The only difference is the age, okay? So to be eligible for low-dose CT lung cancer screening, you need to meet several criteria, okay? For example, age. You need to between, like for USPSTF criteria, you need to between 50 to 80, okay? But if you want to be covered by Medicare, so the range is a little bit narrow, like between 50 to 77, okay? So this is one of the criteria, okay? Another one is you need to be current smoker, or you need to be former smoker who has quit smoking within the last 15 years, okay? And another criteria is the smoking history, okay? You need to at least have 20 pack years, smoking pack years. What does this mean? For example, if you smoke 1 pack per day, and you smoke this amount for 20 years, 1 times 20, so you meet the criteria, okay? So basically, you need to meet the age, smoking status, and the smoking pack year criteria to be eligible to receive a free lung cancer screening, low-dose CT lung cancer screening. Okay, and for sure you should not have any lung cancer diagnosis or symptom before you can do the screening. Okay. Okay. So and also because the low-dose CT lung cancer screening has been covered by the Medicare since 2000, I think since 2015. Okay, and the CMS and the Medicare require the healthcare providers to do a shared decision making before you can order or load the CT screening for a patient, because they said the doctor needs to go through the discussion with the patient for the patient to know what are the benefits and what are the harms associated with the low-dose CT screening, because many of you may know there are several harms associated with low-dose CT screening, for example, like false positive, right? And the radiation, and maybe overdiagnosis. So the patient, they should be well informed about the potential harms before they can do the screening. Okay, and this is required by the Medicare. Okay, if you don't do shared decision making for Medicare beneficiaries, the healthcare provider cannot get paid or cannot get reimbursed. Okay. Okay. So and this is just an introduction about my previous study in Chicago because, like I mentioned, most of the older trans-American smokers, they are immigrants from China, right? Their education level is quite low. So we are thinking about maybe we need to develop a decision aid, especially designed for immigrants because they don't speak English. We need to make the material to be more culturally relevant to Chinese Americans. So we start a study try to examine their health belief about the smoking and the lung cancer screening among older trans Americans. Okay, so this is what we were working with the community organization in Chicago Chinatown. So we're working with the Trans American Community Organization, and we also working with the Trans American Service League, okay? Because the people living in the community, they don't trust us. They trust the community organizations, right? So we work with the community to better recruit the people to our study, and we provide some kind of workshop to introduce the lung cancer risk and maybe introduce the lung cancer screening criteria to the population living in the Chinatown, okay, for them to better understand the importance of lung cancer screening, okay. So this is what we got from the survey. Like I mentioned, we look at their knowledge, belief, and attitudes about lung cancer and lung cancer screening, and you can see the button, okay, especially this one, the photo reason associated with lung cancer, okay, about like 58% of people said lung cancer spreads so quickly, the early detection screening will not help. Okay, so basically they don't think the screening can help to reduce their mortality. Okay, and you can see the last one is the perceived barrier to lung cancer screening, and then many people they said I will put off having a lung cancer screening because the cost might be an issue, right? So this means they don't know the lung cancer screening can be covered. They don't need to pay anything if they are eligible for lung cancer screening, okay? So this is what we found from the survey. So we further use the, this is a decision aid, okay, to help people to facilitate their decision making for lung cancer screening. And this is the decision aid developed by the AHRQ, okay, the Agency for Healthcare Research and Quality. As you can see, this is totally American style decision aid. Our population, they don't like it. Why? You see, this is the feedback we got from the participant. This is the American style promotion method. They talk too much in details, and they're talking too much in details is not good for promotion. This is from our population, okay? And also they said, if you want to tell others, you should try to use people's words. Means, you know, we need to try to revise the material to make it more easier for our population to be understand, okay? And also I remember one participant, he mentioned to me, I'm the most educated people in the room. I still can understand the materials, okay? So this is a very significant issue because this is the decision aid developed by the HRQ for Americans cannot be applied to trans Americans because language barrier, health literacy, and cultural norms are different, okay? Okay, so we use the HRQ and we revise the HRQ materials and make our own lung cancer screening decision aid. As you can see right now, the information is much more concise and much more easier for people to understand. And then we use the Chinese culture, relevant, simple like a calculator for them to understand how the lung cancer screening can reduce the mortality. Okay. Okay. So this is how we develop the material, especially for our population. Okay, so this is our result. After we bring the revised material back to our participant or back to the residents in the community, they said, You see, over 80% of participants, they really understand, they really understood the materials, the information we presented, especially in terms of lung cancer causes and the symptoms, okay? In terms of the criteria and in terms of benefit and the harms associated with LDCT screening, okay? And over 88% of people, they think about the decision aid will help them to make an LDCT screening decision, much more likely. Okay, so basically, the tool can be used with the primary care provider in the community to well-informed decision making with our populations. Okay, and this is a paper-based, okay, paper-based tool. And further, we develop an online version so people can use the tool more easier. For example, this is an online version we developed for decision making about lung cancer screening. So basically, as you can see, there's a calculator, PEG year calculator, because sometimes it might be difficult for older people to calculate the PEG years, right? So they can just easier to put there like the PEG smoking per day and the years smoking they have, and to hit the calculator to see if they are eligible for lung cancer screening or not. Okay, so right now this is a tool. Right now we are testing with the older trans-American smoker living in New York City to see how effective the tool can be used to increase their knowledge about lung cancer screening, and also can be used to reduce their decisional conflict, okay, about lung cancer screening among older trans-American population, okay. Okay, so this is my very brief presentation about lung cancer screening, and let me know if you have any question later on. Okay.